Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN. It's so good to be here. So good to be back. Because y'all know your girl was gone for a while, handling some things, but I'm back in full effect mode. Anyway, it was a lovely weekend. It's gorgeous outside today. I slept in, which for me is sleeping in until 7 a.m. I got up, worked out. I actually baked 2 loaves of banana bread. I had these bananas on my counter that were like beyond ripe. So I'm like, dude, you better use them before you start getting fruit flies. So I made 2 loaves of banana walnut bread. I haven't even cut the loaves yet, but I'm excited. Got some coffee, took my dog for a really nice meditative walk. And I've been doing a bunch of stuff in my office today. I'm actually doing a presentation for Gold Speakers. It's an organization that has an international platform. I'm doing a presentation for them. I think it's in October. So I'm actually pretty excited about that because it's global. It's going to be online. And, it's a great opportunity. So I'm really excited about that. In between that and going through emails and just getting ready for the week in general, overall it's been a really uneventful weekend, which for me is good. I don't have that many weekends that are uneventful. It's been relaxing. I've been binge TV watching. I'm obsessed with Little Fires Everywhere. If you all haven't read that book, you should definitely read the book. I am pretty pleased overall with the adaptation on Hulu. I love Kerry Washington. She's like my girl crush. And Reese Witherspoon was fantastic as well. And, there were a few minor deviations from the plot of the original story, but overall, very well done. So let's just get in today to, I've been going through my emails and just a ton of questions, which I love and I am getting to. Some of them I'm answering via email, but a lot of them I'm answering on my podcast just because it's easier and it allows me to get through the questions a lot more expeditiously. So today's question comes from E, and the subject is trauma survivor. So this is what the message says. Hi, Dr. Angela. I'm a 25-year-old who isn't sexually active, and I've seen a couple of different gynecologists over the years, but they've always been terrible experiences. The most recent one was traumatic, as my first visit with her was as well. I had previously been severely sick and experienced diarrhea for nearly a week. So I was pretty sore and hurt all up in there. Because of the redness and abrasion and just sheer pain, the OBGYN decided that instead of doing the pap smear to have us reschedule it in a few weeks until I healed. She asked if I was abused and if I was seeing a counselor, both of which I said yes. When I returned, I couldn't get through the exam process again. It was so scary and so painful, and even again, wasn't able to complete a simple pap smear. The doctor asked me again if I was seeing a counselor and if it was helping. I was like, wow, okay. Sorry for that sob story. I guess my question is, what advice do you recommend for someone who is trying to take care of her body but who was triggered by being in a pelvic exam position because she is a trauma survivor, also known as me? Thanks for reading this. First of all, E, thank you so much for sharing this. And, this is such a sensitive topic. I'm grateful, beyond that you emailed me this. I'm really sorry that you've had such a horrendous experience with your OBGYN and previous gynecologists that you've seen over the years. I think that the first thing, maybe just to ease your mind, if I were seeing you personally, it would just be a meet and greet. Just really with something this intimate and personal. I mean, when you go to the GYNs in the OB's office, it's a pretty big effing deal. I mean, what other doctor are you so intimate with? I mean, we get to see you and know you inside and out, both literally and figuratively. So, if I were seeing you or any physician that sees you, I think that the first thing that I would do is at least have the first few visits serve as a getting to know you session. Forget the exam at that point. Just building a level of comfort, I think, is really necessary in instances such as these. We talk about what your expectations are from the visit and, what we might as physicians be able to do to help you to feel more comfortable. And again, it may take several visits before we actually even get to the exam, but I think that it's really important to establish a sense of trust and an actual relationship, build a good rapport with the patient. The other thing is offering you kind of like a safety net or a safety person, allowing you to perhaps have someone else in the room. Any patient that I see, I always offer either a friend, family member, or maybe even my medical assistant just to kind of serve as an additional form of support. I also like to go into great detail on what the exam is going to look like. In people that are previous trauma survivors, it's important that you feel like you are in control and that nothing is happening to you without your permission. So what I generally do is I give a very detailed overview of what the exam is going to look like. Just not to be too basic or oversimplify things, it will consist of me saying things to you like, okay, so now I'm going to take a really in-depth history, and we go through all of the details, obstetric, gynecologic, social, medical, any allergies, family history, sexual history, surgical history, all of the above and more. And, putting you in an environment where you're comfortable disclosing that information is first and foremost. When we actually do get to the exam part, I always announce exactly what it is that I'm doing. Okay, now I'm going to listen to your heart. Now I'm going to touch your back and listen to your lungs with my stethoscope. Now we are going to do your breast exam. Now I'm going to listen to your abdomen and do an abdominal exam. And when we get to the pelvic exam, which we take our time, I always announce, this is me on your inner thigh. This is me, a little bit of pressure. Now I'm, doing X, Y, and Z. It's really important for you to be mentally prepared every step of the way. And certainly we don't do anything without the patient's permission or without you being comfortable. I wish you so much luck, because I love that you are wanting to take control of your health and that you are trying. I just think that you probably need to maybe find a physician that you think is a better fit for you and that is able to do a little more hand-holding, along this journey for you. I always tell patients, you always have a choice. And if you don't feel like your provider is giving you everything that you need, seek out someone else. Hopefully this has helped, and I really wish you much success. And by the way, this is not a sob story. It's a very common story. And I'm so happy again that you were brave enough to submit it, because this is going to help a lot of people. So thank you so much again, E, for submitting this. I'd like to thank everyone for tuning in today. And again, for your continued support. I appreciate all the emails, the direct messages. If you all are not, a follower, please hit me up. Go to www.askdrangela.com. That's AskDrangela.com. There you can sign up for my blog posts, my YouTube channel, my podcast, and you can also follow me on all of my social media channels, which are Instagram, Facebook, and Twitter. In closing, I'm going to read you a quotation from one of my favorite books, Congratulations, Graduate. And Henry David Thoreau says, in the long run, you hit only what you aim at. Therefore, though you should fail immediately, you had better aim at something high. And then just another thought, you must have long-range goals to keep you from being frustrated by short-range failures. Interesting. Thanks so much again for tuning in. Hopefully you got something out of today's podcast. Until next time, choose happiness.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health, and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.